Good morning, good afternoon, and good evening to all our friends and colleagues around the world. I, Dr. Prashant Bhasin, the chairman of the International Cooperation Committee of the Global Summit, gives a very warm welcome to our today's international speaker, a great mentor and a great guide, Dr. Sonia. Dr. Sonia, welcome to our Podina session, ma'am.
Thank you very much, Dr. Prashant.
It's a pleasure and honor for us that you have taken your valuable time today and you have actually spreading a topic which will open a different horizons for us. But yes, you have been into the field of dentistry probably more than a decade or so. And I think you have changed the era of the dentistry, changing from a pre-COVID to the post-COVID. So we would like to understand and we would like to know your experience, how it has changed in last 2 years.
Right. First, I would like to thank you for hosting my webinar, and I'd like to thank the Global Summit Institute for this opportunity. As to your question, I feel that pre-COVID and post-COVID, dentistry has actually had a big shift, and especially related to networking and integration of healthcare professionals as a team, which is the topic I'm going to be talking today. I found that because we're more on Zooms and we're meeting more doctors had more time. I'm finding this integration of new healthcare providers and the communication has actually improved, opening up a big channel for doing what I'm going to be proposing we do today, which I think is the future of dentistry and healthcare altogether.
Great. Well, thank you for your deeper insights on the newer horizons of the dentistry post-COVID. So before we go ahead with a very informative session today by Dr. Sonia, I would like to share some credentials with you all. Dr. Sonia is an internationally acclaimed expert in a minimally invasive facial and dental aesthetics procedures. She has 3 decades of the international experience using laser biotechnology in the UK, Brazil, and the United States of America. She successfully runs 2 training academies from Dallas. One is the International Laser Academy and the American Academy of the Orofacial Harmony. She is also actively involved in the craniofacial sleep medicine at the Village Wellness Institute, Sao Paulo, Brazil, and at 2 sleep medicine centers in Dallas, with a holistic approach to the orofacial harmonization. Frontrunner on lasers and photobiomodulation in dentistry in UK and Brazil. She has a master's degree from the Eastman Dental Institute, London, UK, and continuously do research and publications in the area of lasers in the cooperation with the 2 major international affiliated universities, that is the University of Sao Paulo, Brazil, and De Montfort University, UK, from which she is currently working towards the PhD in lasers in biomedicine. Dr. Sonia is a current president-elect for the Group Pharmacology, Therapeutics and Toxicology Group of the International Academy of the Dental Research. She is a counselor of the AADOR, as in both committees, and the IADR Task Force of ADA Committee Working Group for the Development of ADA Standards of Dental Lasers. She was guaranteed the Top 100 Doctors Award in the dentistry in 2020, has several publications, and is on the editorial board of some major peer-reviewed dental journals. Such a vast experience of you, ma'am. It's really amazing for us. And I welcome you all to deliver your great talk with us. Ma'am, the floor is all yours. Please kindly share your presentation.
Thank you. Thank you. Today, I'm going to be talking about the integrative oral medicine in the new trend. First, I want to make a disclosure that I have no financial conflict of interest on what I'm going to present today. So what's integrative orofacial medicine? Dentistry was first described in 2600 before Christ. It was found in the tomb of Hezhe, an Egyptian scribe, as the first inscription, dentist, the greatest of those who deal with teeth and of physicians. In the Middle Ages, dentistry was represented by a guild of barbers in France, which evolved into two groups. The surgeons who were educated and trained and performed complex surgical operations, and the lay barbers who performed the routine hygienic service, including shaving, bleeding, and tooth extraction. In the 18th century, Pierre Fouchot, a French surgeon, was nominated the father of modern dentistry. The 20th century saw great innovations in technology, the water fluoridation and fluoride toothpastes, the development of acid etch technique, bonding agents, and composite resins, the development of lasers, osseointegration of dental implants. The 21st century is the era of digital dentistry, of artificial intelligence, cloud dental records, and integrative healthcare. Some of us are still mainly treating teeth. It's time dentists also move into this new era. Integrative orofacial medicine is a way to move forward. We now have become doctors of head and neck. The National Center for Complementary and Integrative Health new strategy plan for fiscal year 21 to 25 expands the definition of integrative health to include whole person health, aiming at improving people's health in multiple interconnected domains: biological, behavioral, social, and environmental. The plan attempts to better define and map a path to a whole person's health. The National Center for Complementary and Integrative Health from the National Institute of Health also recommends that evidence-based complementary therapy should be integrated with and not used as an alternative to conventional medicine. If a non-mainstream approach is used together with conventional medicine, it's considered complementary. If a non-mainstream approach is used in place of conventional medicine, it's considered alternative medicine. The term functional medicine is used to describe integrative health or sometimes for naturopathy. Integrative medicine is the association of conventional medicine and complementary approaches together. Integrative health and wellness utilize multimodal interventions, conventional plus complementary health approaches in a very coordinated way. It emphasizes the treatment of the whole person rather than focus on a single organ system. It uses well-coordinated care with different healthcare providers. The use of integrative approaches to health and wellness has grown across the United States. Researchers are currently exploring the potential benefits of integrative health in a variety of situations. For instance, in pain management for military personnel and veterans, relief of symptoms in cancer patients and survivors, and programs to promote healthy behavior. Light and electromagnetic devices, for instance, are classified as complementary medicine and fall under the physical and psychological wellness category, as you can see from the graph. For us, dentists, one example would be the use of photobiomodulation therapy to treat various conditions, to promote an integrated approach to health. The way we, as dentists, can incorporate oral medicine into our practice is to use well-coordinated care with different healthcare providers and integrate complementary therapeutic approaches to our daily routine. We need to stop being isolated dentists and build a working team with our healthcare community, using a good and regular communication channel, not only to refer our patients to each other, but also to coordinate our patient care in real time. We can build a team with the head and neck surgeons, the chemo and radiotherapy center, the psychiatrist, the myofunctional therapist and speech therapist, nutritionist, buccomaxillofacial prosthetic reconstruction dentist. We can include psychologists, chiropractitioners, osteopaths, integrative or functional medical doctor, ear, nose, and throat doctor. We as dentists can take the lead as the core provider in many fronts that involves the need of our services. Many diseases and syndromes are first manifested in the oral cavity. We are on the heart of the correlation between periodontal disease and systemic conditions such as cardiovascular disease and others. In oral cancer, for example, we can work in coordination with the head and neck surgeon prior to removal of the oral cancer by making the obturator in advance whenever possible, so the patient can have their prosthetic appliance fitted in the immediate post-surgical, avoiding the need of oral intubation for feeding.